I was really sick in February 2020. I know that if it weren't for having the telehealth, I needed to be able to be seen by multiple doctors and being able to have the telehealth.
Telehealth has made a huge impact in my progress in mental health. I've worked with a lot of great counselors through telehealth with anxiety and depression and a few other issues that I've been going through, and it's helped create a space for me in my own home where I can be in my own room and I feel safe, but also feel connected to my counselor.
When COVID hit, nobody knew how long this is going to last. How are we going to take care of our patients who, frankly speaking, were afraid of even coming into a medical facility? A lot of patients were actually ignoring their own health, trying to just stay at home, trying to stay away from this unknown fear of getting COVID by just stepping into a medical facility.
It was also just to be able to reach out in the times that struggling during COVID and being confined to the home and not able to leave.
During the pandemic, it has changed tremendously. I think this is the technology and the future of the mental health and telemedicine, both combined.
Telemedicine provided them the necessary way of still staying in touch with their doctor's office, getting the necessary care that they need, even though it is remote, having the ability to see their physician's face when they needed them the most.
Definitely the positives were that I could do it from home, that I didn't have to leave to go out and have those concerns that are there, to be able to have a more frequent appointment.
So one of the things that comes to my mind is behavioral health services. There's shortage of psychiatrists in the region, in the state, and nationally. Psychiatry is a perfect example where services can be fully rendered through telemedicine. It is not a service line where you require specific examination or physical exam or touch the patient. It can fully be delivered indefinitely through telemedicine.
Sometimes in person, it's a little bit more difficult to express how things are going. Whereas over telehealth, it was a little easier, especially if it wasn't the video, if it was actually over just the phone. It was a little easier to kind of share what was happening because I didn't necessarily have that face-to-face that sometimes inhibits me from sharing more,
Telemedicine capabilities for our behavioral health service line, 85% plus patients opted to go fully telemedicine. 85% is a huge number.
When traveling to my counselor and when I had to meet with them in person, not that it was completely inconvenient, but it's an hour session, but including the travel time and parking and traffic, it could increase my time being taken away to almost 3 hours. So with telemedicine, it made it much easier for me to get in connection with my counselor, much easier without the travel and without the hassle of having to get to them.
There's a lot of barriers. Not able to come to appointments, transportation issues, work schedules, personal life.
What COVID did is they moved the originating site from a requirement to be at a clinic to any site of patient's choice. So patient got a choice to start a telemedicine visit from their car, from their home, from their work. Now they don't have to take time off from work to be at their doctor's appointment, where an appointment for an hour requires them to take 3 hours off from work on a practical note, correct? Patients are now really looking to continue these services because they have seen how this really helps.
There were tons of positives, and the ability to be able to reach out, made it a lot easier in some sense to have in place, definitely, and especially in the mental health field. I think that was huge to be able to have in place.